This practice is part 3 to the low back pain series that I've been writing about. Please remember that if you have any shooting pain that causes numbness, or sharp pain, you should see your medical care provider. Please begin laying on your back in corpse pose. Allow your legs to relax, feet to open like a book, outstretched, arms at your side. And begin this practice how we begin every yoga practice, by softening and opening to your breath. Welcome a deep breath in through the nose. And exhale completely. As you inhale, feel the breath expand, maybe into the places you feel tight, into the low back and outer hips perhaps. And exhale, release everything. Already noticing that just turning to the breath, breathing expansively, releases the body and relaxes the mind. On your next inhalation, interlace your hands behind your head, elbows wide, as if you were going to do a sit-up. We won't do a sit-up, but interlace the hands behind your head. And on your next exhalation, scoot your torso to the right until you feel a side stretch in the left side body. Extend up and out through the left elbow and downward with the right elbow. Inhaling, feeling length from the top of the left hip all the way through the left tricep, even. Next, scoot your legs to the right as well. Simultaneously, press forward away from you with the left sole of the foot and up and away with the left elbow. Big side stretch. On your next inhalation, come back to center and exhale. Scoot your torso to the left. Elbows are wide. This time extend up and out, away from you with the right elbow and downward with the left elbow. And as you're ready, scoot the legs to the left. Press forward with the sole of your right foot and away from your head with the right elbow. Length through the whole right side body. With your next inhalation, come back to center. And as you exhale, bring your right knee into your chest. Clasp your hands under the right knee. Shoulders are on the floor. Left leg is on the floor. Left foot is flexed. And with each exhalation, hug the right knee toward the outer right shoulder. If your left quadricep is really strong or your hip flexors are really tight, your left thigh might lift away from the floor. Try to avoid that. To do so, press the left foot, the left heel towards the front of the room and muscularly hug or press your left thigh towards the floor. And as you do that, hug the right knee towards the right elbow and you might begin to feel a stretch through the front of the left thigh and hip flexors. Keep your hands where they are, interlaced under the right knee. And on your next exhalation, extend the right foot up towards the sky. So hypothetically, the right femur, the right thigh bone, would be perpendicular to the floor. You may bend your right knee. If you have a belt or a dog leash or a yoga strap, for sure, place the strap around the sole of the right foot and take either end of the strap with your hands. And with each exhalation, you may press the right foot into the strap. Again, keep the left thigh pressing downward into the floor, the left foot pressing forward. And with each exhalation, press the right heel towards the sky. It's better to have the thigh bone perpendicular to the floor with the knee bent than to have the leg straight with the thigh bone at an acute angle. So you're lengthening the hamstrings in this reclined posture. On your next exhalation, bend the right knee, release the strap if you're using one, and extend the leg all the way out onto the floor. Inhale, hug the left knee into your chest, interlace the hands behind the left knee. Hug the left knee towards the outer left shoulder. Press the right heel forward and press the right thigh bone down. Notice if the right thigh bone has a tendency to lift away from the floor. And muscularly press the right thigh bone down. Keep the right leg strong and straight. As you exhale, hug the left knee towards the left shoulder, opening through the top of the right hip, through the hip flexors. Good. On your next exhalation, extend the left heel towards the sky, straightening the left leg. If you're using a strap or belt, place that strap around the sole of the left foot. You may bend the left knee. Keep the left thigh perpendicular to the floor, even if the knee is bent. Hamstring lengthener. With each exhalation, press the foot into the strap. If your hands are clasped behind the knee or under the thigh, gently press the thigh into the hands. Gently press the hamstrings into the hands to create a boundary of support. Last breath here. On your next exhalation, bend the left knee, release the strap, release the hands, and extend the left leg out onto the floor. Inhale, hug both of your knees into your heart. You may rock from side to side. Please roll to the right side. Use your hands to press yourself up, so you're coming to seated with support. And then come onto your hands and knees into table pose. Knees are under the hips. Hands are outer shoulder width apart. Wrist creases are parallel to the front of your mat. Shoulder blades are on your back, and there's a slight tone to your abdominals. Begin some spinal undulations, cat-cow. As you inhale, Lift the tailbone towards the sky. Lift your shoulders and your head so you're arching like a dog. And then exhale, bring the chin to your chest, press the hands into the floor, round the upper back, tuck the tailbone, round the lower back into cat, like a scared cat. And inhale, tilt the hips up, shoulders up, head up. Exhale, round, chin to chest, press the hands into the floor, round the upper back, round the lower back, tailbone to the floor. And continue twice more on your own breath, inhaling. Exhaling, undulating the spine, moving through a full articulation of your vertebra. Good. Come to neutral and please lay on your belly. On your belly, place your elbows under your shoulders for Sphinx pose. Imagine laying on your belly to read a book at the beach. You're propped up on your elbows. Elbows are directly under the shoulders. Palms are down, weight is on your forearms. Hug your legs together. Press your thigh bones down so your lower back lengthens. You might feel that as you press the thigh bones down, your belly button lifts slightly away from the floor. That's good. Keep that strong action of the legs, pressing downward into the floor. On your elbows, draw your shoulders back. Press the hands downward into the floor. Now, without moving your hands, isometrically, pull the hands back toward your feet. As you isometrically pull the hands back towards your feet, you'll feel the spine slide forward, tractioning the lower back forward. So the shoulders move back, the chin is slightly tucked, the hands press down and isometrically pull back towards your legs, the legs press down into the earth, and the spine moves forward. This posture is a lengthener for the lower back. It lengthens the psoas muscle that I wrote about in part 1. Last breath here in Sphinx pose. With your next exhalation, go ahead and lower, make a pillow with your hands. Place your head on the pillow and turn your head one way or the other, whichever way is comfortable. Next posture, locust, shalabhasana, to lengthen your lower psoas, the iliacus muscle, a hip flexor, and to strengthen your erector spinae in the back. Place your forehead on the mat. Reach your hands behind you, palms down on the mat. Squeeze the legs together like they are the tail of a snake. Again, press your thigh bones down. As you press the thighs down, feel the belly button lift slightly from the floor. Inhale, leave your head on the floor, just lift your shoulders. Feel the shoulders lifting, thighs pressing down, belly button lifts from the floor. On your next inhale, lift your head to shoulder height. Lift your hands to shoulder height. Palms are down. Press the thighs down. Shoulders lift. Belly button lifts away from the floor. If you can, turn the thumbs upward toward the sky. So the thumbs are moving away from each other, and you'll feel an adduction of the upper back. But really, I want you to work on pressing the thighs down, lengthening the lower back, and lengthening through the front of the thighs, the hip flexors. On your next exhalation, release. It's a strong posture, but it will strengthen the erector spinae and give a slight stretch to the iliacus and lower psoas. Place your hands at chest level, press onto your knees and back into child's pose. In child's pose, your knees are wide, feet are together. Stretch your arms out in front of you and place your head on the mat or the floor. Your sits bones, your hips, should sink or make contact with the heels. If that doesn't happen, grab a pillow from your house, any pillow, and stuff the pillow on top of your heels, or blankets, and stuff the blanket on top of your heels so that your hips are supported. And with that support, you are able to lengthen the extensor muscles of the spine, the gluteus maximus, and hamstrings. Must lengthen to do this, and the support will help you in that effort. If you feel cramping or tightness in the front of the thighs, you can also place a pillow or blankets under your chest to lift up your upper body a little bit. As you rest in child's pose, as you lengthen the low back, breathe expansively into the lower back. And with each exhalation, notice if there's a release, a relaxation of those muscles in the back. Inhale. Press your hands into the floor and roll vertebra by vertebra up to seated. And come to stand in a standing forward bend. A lot of you listening to this have tight hamstrings. If that's the case, I want you to bend your knees in the forward bend. Your feet are parallel, meaning the second toes are parallel. And for those of you who have back pain due to tight hamstrings, your knees are bent. Soften the knees to allow the spine to release, and you'll make room at the hip joint. Don't pull yourself down. Allow the spine to release. You may place the hands on your shins or on a block or on a chair for support. With your hands on your shins or the block or the chair, inhale, look forward, flat back. Extend the crown of the head away from you, and at the same time, extend the tailbone, the sits bones, in the opposite direction. Lengthening, flattening the back from the sits bones all the way through the crown of the head. Shoulders are on the back. Hold that length and exhale, bow forward again into the standing forward bend. Not pulling yourself forward, just gently releasing forward. Tight hamstrings, knees are soft and bent. Again, inhale, look forward, flat back, extend through the crown of the head and in the opposite direction with the tailbone. Hold here as you breathe, never holding the breath. Place your hands on the hips. Turn the elbows up so the shoulder blades come onto your back. Lengthen through the crown of the head, lengthen through the tailbone in the opposite direction, and on your next inhalation, come up to standing. Take a big step back with your right foot. Turn your feet parallel. Your feet might be as wide as your wrists are wide when the arms are outstretched. Again, second toes are parallel. Hands on your hips. Inhale, lengthen up through the crown of the head. And as you exhale, hinge at the hips without rounding the back, without pulling yourself down, and bring your hands to a chair, to a block, to the floor. Again, if your hamstrings are tight, bend the knees, soften the knees. This posture, wide-legged forward bend, Prasarita Padottanasana, lengthens the inner thighs, your adductors, and your inner medial hamstrings. Now, for those of you with very tight hamstrings and that very rounding back, again, bend your knees and press your thigh bones back as if you were trying to arch the lower back or send the tailbone, the hips into the air to create a lumbar curve. I want your tailbone to be the highest point rather than your vertebra. So bend your knees enough that your vertebra can move inward and your tailbone can tilt upward to the sky. You can look at the picture in part 2 of the back bend series, of the back pain series, for a demonstration of that. Last breath in Prasarita Padottanasana. Now, walk your hands toward the left. Turn the left foot towards the front of the room. Square your hips. Square your hands on either side of the left foot so you're in a lunge. Draw the right hip forward and the left hip back. Come onto your fingertips. Bend the left knee to 90 degrees. As you inhale, lengthen the spine forward, keeping the length in the back body. Keep the right leg, the back leg, lifted. Press towards the back of the room with the right heel. And you'll begin to feel a thigh stretch, a psoas stretch in the lunge. On your next exhalation, step forward with the right foot and switch, step back with the left foot. Frame the front foot with the hands. Bend the right knee to a square. Draw the left hip forward and the right hip back. Keep the left thigh lifted. As you inhale, lengthen the crown of the head forward. Press the left heel towards the back of the room. Now, if it's hard for you to have your hands on the floor, again, you can place your hands on a prop, on blocks, for instance, if you have blocks. That'll lift your torso and give you more room in the hip joint. On your next exhalation, step forward with the back leg and come to seated. Please lay on your back. We have 3 more postures. On your back, bend your knees. Place your feet on the floor just beneath your hips so that if you outstretch your arms, your middle fingers could just barely reach your heels. Feet are parallel. Press the backs of the shoulders into the floor. Press the back of the head into the floor. Press all 4 corners of your feet into the floor. Make sure there's a small arch under your lower back, just big enough for a tiny creature to crawl under the back. On your next inhalation, push down with your feet and lift the hips up towards the sky. Press the backs of the shoulders into the floor. This is bridge pose. There's a lengthening through the psoas in bridge pose. It's a gentle back bend. Hug your knees to the midline. Don't allow your thighs to flare open. Imagine or actually place a block between your thighs if you have one, and hug that block to the midline with your thighs so you keep the thighs parallel. On your next exhalation, slowly roll down vertebra by vertebra to your back. With your next inhalation, hug your knees to your heart. Open the arms out to the side in the form of a T. And on your next exhalation, lower the knees to the right side for a reclined twist. Now, if you're really tight through the back, especially through the thoracic spine, the middle back, place your knees on a blanket or a pillow. So you'd place a pillow on your right side and rest your knees on that blanket or pillow for support. And with each inhalation, breathe into the left side body, and as you exhale, release the left shoulder towards the floor. You're not pushing, you're not pulling. You might even feel lengthening through the outer hips. Inhale, bring the knees back to center. If you're using a blanket or pillow for support, move it to the left side. And exhale, lower the knees all the way to the left side. Spinal twist. Inhale, bring the knees back to center. And exhale, lengthen the legs onto the mat for your final resting pose, Shavasana. Allow there to be a small space under the low back. I say just enough for a small creature to crawl under. The low back is not pushing into the floor. Release the legs so the feet open like a book. Palms face up. Close your eyes. Release all effort. Feeling the expansive, healing quality of the inhalation and the relaxing release of the exhale. If in corpse pose you really twinge in the low back, you may roll a towel or a blanket or a pillow and place it under your knees. That can relieve the twinginess in the low back. But if you can relax without the blanket under your knees, do so. Please invite yourself to stay longer in the corpse pose, perhaps meditating on your breath or the sensations you feel in your body or the sounds going on around you. And otherwise, inhale, hug your knees to your heart, roll to the right side, and for the health of your back, use your hands to push yourself up to seated. This practice lengthened your psoas, lengthened your other hip flexors, it lengthened your hamstrings, it strengthened your gluteus a bit, it lengthened your spinal extensors and even strengthened your rectus spinae. The practice wasn't complete with all of the postures you could do to help your lower back, but I hope it gave you an idea of the body mechanics of how to help your back with yoga and some exercises you can do non-invasively on a daily basis. Again, please, if you have any sharp shooting pain or numbness, do see your doctor.